The National Institute for Communicable Diseases says it continues to monitor what it calls a sustained increase in the number of laboratory-confirmed COVID-19 cases in the country. In the latest reporting period, South Africa reported the highest number of new coronavirus infections in more than 4 months. The country recorded 5,782 cases in the latest reporting cycle. The NICD says that this means the country is officially entering the third wave. The total number of infections is now up to 1,675,013. 110 people have died of COVID-19 related complications in the latest data, increasing the total number of deaths to 56,711. The Health Department says that the positivity rate now stands at 12.7%, with Gauteng showing the greatest surge in new infections. The recovery rate in the country is at 93.5% when it comes to vaccinations. More than 637,800 people have now received their first dose of the Pfizer jab. Let's continue on this topic then. For more on this, we are joined via Zoom by Dr. Michelle Groom, who is Head of Division for Public Health Surveillance and Response at the National Institute for Communicable Diseases. A very good afternoon to you, Dr. Groom. It's a pleasure to see you again. Thank you for availing yourself to SABC News, ma'am.
Great. Good evening, and good evening to everyone.
Just as a start, I'd like to start before we talk about, the increasing numbers that we're seeing, the surge that we're seeing at this time, certainly very concerning. But I want to talk about the issue of vaccinations. Of course, now we're hearing that over 1 million people have now been vaccinated. Very important issue that. Are we indeed, Doctor, managing from where you sit, to cover vulnerable groups in those specified sort of categories, those age groups that we were planning to indeed vaccinate? When it comes to our vaccination drive, what is your reaction at this time?
Yeah, so I think it's important to notice that obviously there's been 1 million doses given, and part of that was done, to healthcare workers as part of the phase 3 Sezonke study. And so I think it's important to remember that for Pfizer, it's actually a 2-dose schedule. So those that have received the Pfizer vaccine have all just received 1 dose, so they're not yet fully vaccinated. Although we've administered 1 million doses, I think important to remember that, but not all of those. We haven't got 1 million doses. We haven't got 1 million people who are fully vaccinated. I think we are managing. I think it's very encouraging that we are managing to get to those vulnerable. So definitely the elderly have a lot of comorbidities as well. And those 60 years and older definitely are at highest risk for severe disease like hospitalizations and death. And so it is encouraging that we are managing to get to them. But we really do need to kind of speed up our vaccination program and to try and vaccinate all our vulnerable elderly as quickly as possible, and then move on to the other groups with high comorbidities and that are at high risk of infection.
Dr. Groom, does it feel to you, as someone in the medical fraternity, that it sometimes feels like, you put out one fire and then, another one sort of occurs again? I mean, just in terms of the fact that here we are, it seems like, there is indeed progress being made in terms of the fact that here we have 1 million people. I mean, that's a huge number of people that have at least gotten that first vaccine. But then now we're dealing with, and that's obviously the point of our conversation here today, now we're then dealing with the issue that those numbers are rising again. We're experiencing that issue of deaths again. So although on the one hand we're making an improvement in terms of having those vaccinations, the numbers are then increasing. And I wonder what your view is on that, and how we really just counter that. I mean, we obviously thought that vaccination drives would counter that, but it does this. I mean, what do you have to say to that?
Yeah, look, I mean, it's really unfortunate. I mean, in the perfect scenario, we would have wanted to vaccinate kind of all the vulnerable before the third wave kind of looked like it was hitting us. So I think at the moment, I guess the risk is really that, we want to limit, social interactions in our most vulnerable, in the elderly. And so, at the same time, we're trying to get them to access vaccination points. And so we really need to then weigh up, how we do that in terms of not putting them at added risk by actually going for their vaccinations. So I think where if case numbers were very low, we could really speed along with the vaccine program. I think now with the increasing numbers, obviously resources may also be needed in terms of just managing the increasing number of cases, and so we may not be able to use all those resources for vaccination. So I think not the perfect scenario now with cases increasing just when we're getting our vaccination program up and running.
Yeah, and I mean, what is your biggest concern at this time, just as a closing sort of statement in terms of your key concerns when you're monitoring developments on the daily cases? I mean, we it seems that people are trying to adhere to the rules, the wearing of masks, the social distancing as much as we possibly can. I mean, what more at this stage can we then do, and what are the main concerns that you have at this time?
Yeah, look, I think it's, the country as a whole is not really in a third wave according to the metrics. So I think really just to remember that the provinces that are mostly affected was, initially Northern Cape, Northwest, Free State, and most recently Gauteng. And, I think people are tired. There's been restrictions and impact on our lives for over a year. And I think really just, the social interactions are probably the most important. We have had the new restrictions, going to an adjusted level 2 to limit the social interactions. But I think for everyone just to really be on alert and particularly to protect our most vulnerable. So if you have elderly in your households, to try and keep them home as much as possible, get them to register at least for vaccination and try and streamline that. But I think the most important thing really is just for everyone to try and go that extra mile, to try and, especially limit the social interactions. And if you are ill, to isolate and to really, there's a lot of asymptomatic spread of infection, unfortunately, which is difficult to manage. And so if you've been in contact with someone that's positive, I think it's really important to self-isolate to limit the spread of infection during this time.
All right. Thank you very much for speaking to us, Dr. Groom. It was a pleasure having you with us here on SA Today on SABC News this afternoon.